So now we had seen about the MHC molecules also. Next, we'll move on to the hypersensitivity reaction. So as the name suggests, there is going to be some sensitivity which is higher for certain antigens. So hypersensitivity is going to be present. We have 4 hypersensitivity reactions mainly. There is a 5th type as well now. So the first type of hypersensitivity reaction is also called as the immediate type of hypersensitivity. Immediate meaning immediately as the antigen is exposed, there is going to be a reaction. So that is what is called as immediate type of hypersensitivity reaction. So in this type of hypersensitivity, what happens is whenever the antigen is coming, suppose an example of a pollen grain. So this antigen is going to attach with the antigen presenting cell, which will process it, and with the help of the MHC complex, it is going to present it to the T cell receptor, and this T cell will then change itself into a subset like Th2 subset. So this Th2 subset is going to produce interleukins 4, 5 and 13, right? So this 4 was responsible for immunoglobulin production and class switching. So since it was a pollen, it is going to be related with allergy kind of a response. So in allergy, we have the IgE production. So IgE class switch is going to be produced and IgE immunoglobulins are produced. Then interleukin 5, already mentioned, it is going to activate the eosinophils. So this again is going to be present. What happens is that this immunoglobulin E, IgE, which was produced, it is going to go and coat the mast cells. Okay, they are going to sit on the mast cells now. So this is what happens when the primary exposure to the antigen has happened. With subsequent exposure, that is the second exposure, what happens is this mast cell, this antigen is going to come and attach with the IgE present on the mast cell, and this will result in the polymerization of IgE. So lots of IgEs are going to get attached to that. So polymerization of IgE is going to cause the degranulation of the mast cells. So the mast cells, the granule contents of the mast cells are going to be released. So the most important content of the mast cell is going to be various histamine, serotonin. Apart from that, other newly synthesized inflammatory mediators as well. So during inflammatory mediators, we had studied about the various inflammatory mediators, right? So histamine, serotonin was the main one, which is going to cause the immediate type of reaction, which is vascular events like vasodilatation, increased vascular permeability and bronchoconstriction. So all of this immediate reaction is going to be mediated by this histamine, while later on it is going to produce newly synthesized antibody, while histamine was a preformed antibody, right? So that is why it is immediately causing reaction, while after some time it is going to have certain other reactions like prostaglandins, leukotrienes, platelet activating factors. These are going to be newly synthesized, and these newly synthesized inflammatory mediators are the one responsible for the late phase of this type 1 hypersensitivity reaction, and this is the one which is responsible for causing the tissue injury associated with type 1 hypersensitivity. So early phase of type 1 hypersensitivity is going to be because of the histamine, which is a preformed preformed mediator, while late phase is going to be caused by the newly synthesized inflammatory mediators like prostaglandins and leukotrienes, which is responsible for the tissue injury. So what is the most important cell of type 1 hypersensitivity? If they ask, it is going to be the mast cell. In general, the most important cell of type 1 is mast cell. While specifically if they ask for the late phase, it is going to be eosinophils. Okay. So eosinophils is again going to produce this inflammatory mediators, newly synthesized inflammatory mediators, which were responsible for the late phase. Okay. So type 1, important one is the mast cell. Late phase specifically, it is going to be the eosinophil. And the eosinophil is, whenever eosinophils are going to be accumulated, it is going to result in tissue injury. Okay. So let's see the examples of type 1 hypersensitivity reaction, which are atopy. So atopy, allergy, anaphylaxis, bronchial asthma, Cassini's test, and Prosness-Kuttner test. So allergic reactions to any pollen grains, dust particles, or the allergic rhinitis, we call it as, okay, allergic rhinitis, allergic dermatitis, then we have allergic conjunctivitis. So all of this are going to be examples of type 1 hypersensitivity. We also have hay fever. Anaphylaxis is a very life-threatening kind of condition wherein you have laryngeal edema and everything. Again, it is going to be a IgE-mediated type 1 hypersensitivity reaction. Bronchial asthma, we know, spontaneous bronchospasm is going to happen. Then Cassini's test. Cassini's test is actually used for detecting the Echinococcus granulosus. So Echinococcus granulosus is the infective organism for causing the hydatid cyst. So hydrated disease we know, right? So hydrated disease is going to be caused by Echinococcus granulosis, and that we detect with the help of this Cassini's test, which is again an example of a type 1 hypersensitivity. This test is actually obsolete now, but for examples, you need to remember it. Now let's move on to the type 2 hypersensitivity reaction. Type 2 hypersensitivity reactions are also called as antibody mediated reaction because it is going to involve the antibodies. Both type 2 and type 3 is going to involve antibodies, but the difference between type 2 and type 3 is going to be, in type 2 the antigen against which this antibody is formed is actually present on a fixed tissue. So the tissue is fixed, the antigen is present on the tissue, and the antibodies are come and going to act against this antigen. While in type 3 it is going to be the antigen is circulating in the blood somewhere, and against this antigen the antibody has formed, and it is attached, this immune complex of antigen and antibody complex had formed in the blood itself, and this immune complex is then going to deposit on some tissue. Okay, so this is the basic difference: fixed tissue for type 2 while circulating an antigen for type 3. Okay, so the mechanisms by which this type 2 hypersensitivity reaction takes place is, we have various mechanisms. First one is the opsonization or phagocytosis. So there is, as the name suggests, there is going to be some opsonization. So opsonization will result in the EC phagocytosis, right? So there is a cell which is going to be opsonized by C3b and IgG. So C3b and IgG, we know these are the opsonins. They are going to cause the they are going to coat the cell and cause the opsonization. And then these opsonized cells will be easily recognized by the phagocyte. This phagocyte is going to have receptors for both this immunoglobulin G and C3b. So when this interaction between this phagocytic cell and opsonized cell is going to happen, it is going to result in the phagocytosis. Apart from that, this FC receptor, which is going to be present on the immunoglobulin, is going to attach complements. So complement is going to attach to the FC portion of the immunoglobulin, and this is going to again activate the complements. So complement activation is going to take place here as well. This complement activation, the end product of which is the MAC complex, which is membrane attack complex. So this is formed by the C5 to C8, right? So this is going to form the membrane attack complex, and then this is going to cause the lysis of the cell. So the examples by this mechanism of type 2 hypersensitivity is any kind of blood related ones. So blood transfusion reactions, RH incompatibility, autoimmune hemolytic anemias, autoimmune thrombocytopenias, all of these are going to be happening by the opsonization and phagocytosis mechanism only. So suppose in RH incompatibility, let's take the example of RH incompatibility. So the opsonized cell will be an RBC basically, against which the immunoglobulins are come and attached. So this opsonized cell will be killed by the phagocytic cell, resulting in hemolysis. Apart from that, there is also going to be this complement activation, which is again going to cause the lysis of the RBC. Okay. Next, move on to the second mechanism by which this type 2 hypersensitivity takes place, which is called as ADCC or antibody dependent cell cytotoxicity. So there is going to be antibody dependence here, and then there is going to be some cell which is going to cause cytotoxicity. So this is going to be mediated by this NK cell. So NK cell, I have already told, it is going to attach with the FC portion of the antigen antibody immune complex. So this FC portion will interact with this CD16 present on the NK cell, and when this interaction takes place, the NK cell is going to kill the cell which kill the antigen which has been brought up by this complex. So this is result in the cell lysis. So this is the second mechanism. So the third mechanism is complement and FC receptor mediated inflammation. So as the name suggests, there is going to be some inflammation here and some complement activation here. So suppose there is a fixed tissue here like a basement membrane. So kidney basement membrane we are going to take. So in the example of a Goodpasture syndrome, so the antigen here is going to be the collagen type 4 present on the basement membrane. So against this antigen, antibodies are going to be formed. So we have the complements which can attach to the FC part of this immunoglobulin, and that will result in the activation of the complements. Okay, so activation of the complements will produce complement products like C3A and C5A. So C3A and C5A were anaphylatoxins, right? So they can recruit further more WBCs. Apart from that, the FC receptor present on the WBCs can also interact with the FC portion of the immunoglobulin antigen complex. So this again is going to cause WBC recruitment, and this aflatoxin is also going to recruit WBCs. So lots of WBCs are going to come, which is going to be part of this inflammation. So when WBCs come, they are going to produce reactive oxygen species, which is going to both kill the cell and also cause surrounding tissue injury. In this case, the killing will be of this cell, which is the basement membrane. The base membrane is going to get damaged. So the best example of this will be a good pasture syndrome and acute rheumatic fever. Even in acute rheumatic fever, here there was molecular mimicry, right? So the antibodies formed against the streptococcal antigens were actually causing cross mimicry, and they were attaching to the various host antigens like present on the heart and also on the joints. So the fixed antigens present on the heart and joints are going to be acted upon by the cross-reactive antibodies, and that will result in the damage to the heart and joints by complement activation and inflammation. The fourth mechanism of type 2 hypersensitivity is antibody mediated cellular dysfunction. So as the name suggests, there is going to be some antibody present, and that is going to cause some dysfunction of the cells. So we have two main examples under this. So in this myasthenia gravis and Graves disease, both the Graves are going to be examples for this kind of thing. So here what happens is, at the nerve junction, so the nerve muscle junction, this is the nerve muscle junction overall, and here at the nerve ending there is going to be production of acetylcholine. So acetylcholine is going to be released, and the acetylcholine receptors are going to be present at the muscle end. So normally what happens is, this acetylcholine will come and attach to this acetylcholine receptor, which will result in the contraction of the muscle. Okay, this is the normal thing. But in this type 2 hypersensitivity reaction, what happens is, there is going to be production of the autoantibody against this acetylcholine receptor. So this immunoglobulin is going to be produced against the acetylcholine receptor, and this will block the acetylcholine from binding to its receptor. So that will result in the weakness of the muscle. So the muscle is not able to acetylcholine receptor is not able to attach with acetylcholine. So the muscle cannot contract. The patient will complain of muscle weakness. Especially the weakness will be of the orbital muscles. So orbital muscles, we use it many times, right, for blinking. So maximum fatigue will be there for this orbital muscles. So as the day progresses, the patient will complain of orbital muscle weakness. This is for myasthenia gravis. Then the other example is a Graves disease. Here again, autoantibodies are formed against the TSH receptor present on the thyroid follicular epithelial cells. So what happens is, these antibodies are actually acting as a stimulating antibody. So normally the hormones will come and attach to this TSH receptor and cause the activation of the thyroid. But then this immunoglobulin, without the hormone itself, it can directly activate this TSH receptor and cause thyroid hormone production. So it is resulting in the hyperthyroidism. Okay, so this antibody, which is acting against this TSH receptor, is also called as long-acting thyroid stimulator, or LATS. It is also called as the thyroid stimulating immunoglobulin, or TSI. So LATS or TSI is going to be present in Graves disease and then myasthenia gravis. Both of these Graves are going to be examples of type 2 hypersensitivity reactions. The third type of hypersensitivity reaction is called as a immune complex mediated hypersensitivity reaction. So here again I mentioned the antigen has to be a circulating antigen against which the antibody is formed and attach it. This antigen-antibody complex itself is formed in the blood itself, and the circulating complex will come and attach to a fixed tissue, and then it will activate complements. This is the basis of type 3 hypersensitivity, and usually it is associated with vasculitis. So, so characteristically we see fibrinoid necrosis in these type 3 hypersensitivity reaction, especially when it is associated with this vasculitis. So the best examples of this type 3 hypersensitivity exam will be serum sickness, then Arthus reaction, then SLE, Henoch-Schönlein purpura, reactive arthritis, post-streptococcal glomerulonephritis, and polyarthritis nodosa. So in SLE, if you see, it is going to be both type 3 and type 2 hypersensitivity, okay? But more of type 3 hypersensitivity. So remember it, SLE also has 3 letters, so it is more of type 3 hypersensitivity more than type 2 hypersensitivity in SLE. Henoch-Schönlein purpura, it is going to be the most common form of vasculitis seen in children. Usually it is associated with renal disease and also joint pain, abdominal pain, and also kidney renal dysfunction causing hematuria. So it is a glomerular nephritis kind of a picture will be there. So here there is going to be purpuric presentation. So purpura is normally seen with thrombocytopenia. When platelet counts are less, it will result in a pinpoint kind of hemorrhages called as petechiae and purpurae. But in this HSP, this purpurae is not related to the thrombocytopenia. In fact, in HSP, there is going to be thrombocytosis rather than thrombocytopenia. It's also called as non-thrombocytopenic purpura. As such, this purpura is caused because of the vasculitis. Okay, so vasculitis is the cause for this purpura in HSP. Okay. And here the antibody is going to be IgA mediated response. So this we'll be reading again in detail when we are seeing kidney chapter. Okay. So the examples of hypersensitivity reactions are very, very important MCQs. So let's move on to type 4 hypersensitivity reaction. So type 4 hypersensitivity reaction is also called as delayed type of hypersensitivity reaction. So it takes some time for this type of hypersensitivity, and it is going to be a cell-mediated hypersensitivity. Okay, it's also called as delay type or cell-mediated hypersensitivity reaction. So some cell is going to be mediating this hypersensitivity. What type of cells? It is going to be T cells. Both T4 helper cells and CD8 positive cytotoxic T lymphocytes. Both these cells are going to be responsible for this type 4 hypersensitivity. So under CD4 helper C cells, we also initial interaction between the MHC complex, which basically the MHC2 complex with the T cell receptor is going to activate the T cells, and the T cells will get converted into T helper subsets, and then if it is going to form the TH1 subset here, producing interferon gamma, because interferon gamma is the one responsible for granulomatous formation. So granuloma formation is going to be a delayed type of hypersensitivity reaction, which is a type 4 hypersensitivity. So remember, so here it is TH1 subset producing interferon gamma, granuloma formation. So this happens with the first exposure, and the granuloma formation will happen at the second exposure to the further exposures to the antigen. So best examples are also CD8 positive T cells can also produce this cell-mediated type of hypersensitivity. So both the perforant pathway and the fast fascicle pathway is going to cause the cytotoxicity. So lysis of the cell is going to be produced. So both these mechanisms are going to result in this hypersensitivity reaction. So what are the examples of type 4 is rheumatoid arthritis, multiple sclerosis, type 1 diabetes mellitus, contact dermatitis, then various granulomatous infectious diseases like tuberculosis, histoplasma, syphilis, malaria, leprosy, psoriasis, and inflammatory bowel disease. So all of these are examples of type 4 hypersensitivity reaction. So remember, it is contact dermatitis. Allergic dermatitis is for type 1 hypersensitivity, while contact dermatitis is for type 4 hypersensitivity. So as the name suggests, there is going to be contact with some certain antigens which is going to cause hypersensitivity. So mostly we have IV poison, which is present in urushiol. Then we have nickel, detergents. So sometimes you see people complaining of some reaction to their skin when they are using safety pins. So that is an example of contact dermatitis. Again, for soap usage, so when they are washing clothes, they get some kind of dermatitis. It's contact dermatitis. Again, example of type 4 hypersensitivity. Okay, so type 5 hypersensitivity is actually a subtype of the type 2 hypersensitivity only. That is, here it is going to be, again, antibodies are going to be produced against the cell receptor. So both the Graves I mentioned, right? Myasthenia gravis, which had antibodies present against the acetylcholine receptor, and Graves' disease, which had antibodies which are actually stimulating the TSH receptor without the hormone. So both of this is going to be called as the type 5 hypersensitivity reaction. Actually, it's basically a subtype of the type 2 hypersensitivity only. To summarize, we have various examples of this hypersensitivity. Very, very important MCQs. Don't forget to revise this. So type 1 hypersensitivity, any kind of allergic reaction is going to be type 1 hypersensitivity. So allergy, atopy, anaphylaxis, bronchial asthma, Cassoni's test. So all of this is type 1 hypersensitivity. Then type 2 hypersensitivity, we had 4 mechanisms. So fixed antigen should be present. So Goodpasture syndrome, myasthenia gravis, then Graves' disease. Then other than that, all the blood-related ones, RH incompatibility, IHA, autoimmune thrombocytopenia, blood transfusion reactions, rheumatic fever. Then we have this pemphigus vulgaris, pernicious anemia. So all of these are going to be examples of type 2 hypersensitivity. Type 3 hypersensitivity was immune complex mediated. So best example was SLE. Then we had all 3-letter ones. So SLE, polyarteritis nodosa, PAN, HSP, PSGN. So all of these are examples of type 3 hypersensitivity. Type 4 hypersensitivity, any kind of cell-mediated hypersensitivity. That is, type 1 diabetes, we have cell-mediated hypersensitivity against the islets of pancreas. So that is going to cause this type 1 diabetes, producing decreased insulin, right? So rheumatoid arthritis, multiple sclerosis, contact dermatitis, psoriasis, all of this, and granulomatous infectious disease, all of these are example of type 4 hypersensitivity.